Welcome back to Politics Nation. The pandemic has put a spotlight on physicians of color, particularly African-American doctors, who this year watched as COVID-19 disproportionately ravaged black communities. And a combination of factors, including cultural trauma, led to a gap in vaccine distribution that public health workers are still trying to close. In addition to all of that, black doctors must still contend with the nation's original plague, racism, in this case within the medical field itself. And for that, there is no proven cure. Joining me now from Illinois, twin sisters, psychiatrist Dr. Brandy Jackson and internal medicine Dr. Brittany James. Doctors Jackson and James, I want to start off with your shared experience, because I don't know it's fully appreciated that black physicians face challenges that compound an already difficult job, whether it's racist patients who don't believe you're actually the doctor, or administration that doesn't always care. To that end, you've certainly founded the Institute of Anti-Racism in Medicine, which has a unique approach to educating physicians about institutional racism in your industry. What does that education entail, and what led to its creation? Dr. James, you first.
Yes, first of all, thank you so much for having us. I will say, with the pandemic, it's like something finally snapped. What the world is becoming aware of, which is profound disparities across racial lines in just about every dimension. The thing for America, it was COVID. For me, it was working on the south side of Chicago, treating my patients who are 100% Black, seeing disparities, differences in their health outcomes, diabetes, high blood pressure, maternal mortality, infant mortality, cancer survivorship, cancer screening. Every single major chronic disease is worse for Black and brown people. And I think it took this pandemic to really, what I say, radicalize me and say, you know what? The answer is not in our institution. It's not in medicine. We have to really build something brand new and envision a new type of way to deliver healthcare. And for us, that starts with educating the people, doctors, healthcare providers, who just don't understand the reality of what it means to be Black and brown in this country and try to get health care.
Now, as a psychiatrist, I want to ask you, Dr. Jackson, we've seen a move from some public health groups like the American Medical Association recently to approach racism as a public health risk. And I've read where you broke down crying in a class you were teaching over the murder of George Floyd last year. We talk a lot about, on this show, about the health effects of environmental racism, where tangible things like air pollution and toxic waste make Black people sick. But what about intangibles, like being bombarded by the images of police killings of Black Americans? What does that do to the mind, and from that, the body?
The effect on the mind of seeing the really murder in real time of people that individuals identify with. This is hitting home. Really, it's incalculable. I worry a lot about my patients. I worry about their mental health. I was thrilled to see the American Medical Association take a big positive step in the right direction in calling out white supremacy, naming it. It was a bold move. I trust Dr. Maybank. I trust that the intention is there. But of course, it's accountability. And we'll be there for that, for the accountability piece, because that's very, very critical.
One of my producers, Deja, flagged this story that blew my mind this morning. Florida's Secretary of Health revealed this week that nearly 40% of white Florida residents have been vaccinated, compared with only 20% of Black residents. But what's brutal to even think about is only 7% of the total vaccinated population is Black. That's about 658,000 people out of roughly 9 million. Your thoughts? First, Dr. James.
You know, this is so telling. And oftentimes we talk about this great recovery that's happening, you know, from COVID. We're largely leaving out Black and brown people. What we're talking about is that white people are, you know, have been able to get access, have been able, especially if they're moneyed, especially if they're not in a rural area, have been able to have that access. And I think when we look at places like California, though, who've gotten their rates down to 1%, what they've done is actually go to the most vulnerable communities, come up with innovative strategies to get the vaccines into Black and brown communities. And unfortunately, we haven't seen that nationally to the same degree. And so we're getting numbers like this. I think it's important that if we're talking about how to come out of this pandemic, we can't leave Black and brown people behind. We need to make sure that we're focusing in on those numbers to understand that we have a lot of work to do and a long way to go before it's normal for our communities.
Even in a pandemic, to see this racial divide, when everyone should have been equally alarmed and equally concerned, as many of us, if not most of us, saw loved ones impacted by this, Dr. Jackson. But even in a pandemic, we see this racial divide?
You know, it really does boggle the mind, but I have to say, as a student of human history, I think if we don't fight very actively against division, there is a tendency to group off and look for those who you identify as your circle. I think it's time to move past that. At the Institute of Anti-Racism in Medicine, we focus on restorative justice. We focus on healing because we are healers, and we believe truly we're fighting for the soul of medicine. And we're here to tell the truth.
You know, Dr. James, we tell our people, our youngsters, that go to school, be somebody, be a doctor, and then they face the racial barriers that you and your twin sister face to even practice there. And I don't think many white Americans understand that even though we try to put those principles and that ambition in our kids, we have to have the conversation, but you're going to have to go across hurdles that others in your profession won't have to face.
It's absolutely true. You know, I've been so many times, you know, questioned to be cleaning staff, house staff, and there's nothing wrong with that, but I'm a physician and people can't bring themselves to envision that that's true. But, you know, I think if you're just focusing on that, even that pales into comparison to the racism, the systemic racism, just to survive medical education that it brings about. The trauma of being taught by professors that Black and brown bodies are inherently diseased, that there's something wrong with us, that if we're sick, it's our own doing because we didn't work hard enough. And so, you know, and then you see this, you know, even in getting promoted up rank in academic medicine and getting research grants, the racial oppression is throughout, and it doesn't stop when you get your MD. Yeah. And I think if people understood that, they wouldn't be surprised to know that I don't particularly think that we're unique or particularly special. In fact, many of my patients on the South Side are absolutely brilliant, and they don't get the same chance to be physicians because the world doesn't think that they're valuable. And so, you know, we're not that different, but the difference is I survive what has been a very hostile system, and many, just like many Black and brown people in medicine do, to serve.
I'm going to have to leave it there. Dr. Brandi Jackson, Dr. Brittany James, thank you both for all that you do. And I have this feeling that we will see you again on Politics Nation. Up next, now that Republicans have shown Liz Cheney the door, what does the future look like for the GOP? We'll cover that in the rest of the day's political headlines after the break.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.